Welcome to the Overpayments Efficiencies Returning Money webinar. We will focus on how you get money back to WPS after receiving an overpayment letter. I'm Tom Ryan with Provider Outreach and Education, and I'll be your presenter today. Today I'm joined by Mary from my team, and she's here to help with that chat area. She will put some additional resources or other items. She's going to monitor the chat, answer questions she can, or refer those questions to me when I ask for them. As a reminder, the last slide in this presentation is a disclaimer. It does state that we are presenting the most current information and that this is for educational purposes only. So what are we going to try to do within this webinar? Well, first, we're going to look at how to return money to webinar to avoid, or I'm sorry, how to return money to WPS to avoid issues. We'll talk more about what that issue is and what the problems are, but to do that, we do have to answer some basic questions. So we did receive some questions, and that led us to putting definitions for the overpayment process in general and giving a little bit of background so that you have a better understanding of what it is. Also, let me to talk about the options for overpayments. How do you get to return money to WPS? And last, we're going to do a question and answer session. So what I'm going to try to do is work my way through all the questions that you gave me, and then we'll start with the remaining questions, the question and answer session, followed by anything that you have in the chat. So that's how we're going to kind of work our hour today. So first, I was asked to provide a better understanding of the overpayment process, and also they're looking for clarification on overpayments. So with those two statements, I felt like we needed to start back at definitions and an overview. I do want to welcome anyone who's new to Medicare. I do have a few of you that did indicate that you're new or you're just getting started. This is why some of the confusion occurs. So with that said, I will stop after we get through, quote, the definition section and ask Mary if there's any questions in the chat. I don't want to leave anyone behind because if you don't have those questions answered, it may become a bit harder to understand the rest of it. One other thing, there was a question on acronyms. I don't know which acronyms you're talking about, but I will tell you that there are a lot of acronyms in Medicare. So if I use an acronym in this class and you did download the presentation, check the notes section. It'll have an acronym down there for you. If there's something that I use or speak but don't define, in other words, it's not on the slide, please put that in the chat. Mary can help you with that. All right, let's get going with these definitions. So of course, the first slide underneath that has DHHS, which is an acronym, and that stands for the Department of Health and Human Services. Now this is the department in the federal government that the Centers for Medicare and Medicaid Services, who provide the daily operating of Medicare, report to. So again, the Department of Health and Human Services, or DHHS. Now they actually do define an overpayment. So overpayments are exceeding the regulations and statutorily properly paid amount. It's a lot of words and a lot of it put out there. Let's just define it down really fast. Basically, an overpayment is when you owe Medicare money. We are required to collect that money as your Medicare Administrative Contractor, or MAC. Our job is to process claims, but then to look to the provider community for any money that is owed to Medicare for any reason. We do issue you a demand letter. This demand letter explains what you owe, why you owe it, things like that. So lots more to come on that. Because this is a debt owed to the federal government, you do have to pay it back. If you do not pay it back, the federal government instructs the Medicare Administrative Contractor to offset your future claims until that debt is fully paid. So it is something that will be taken back whether you choose to give us the money back or not, and you can also choose to tell us you want to give us the money back. So we'll talk more about that. One of the new people indicated they were new to Medicare, and they said, why would Medicare take money back? What is this overpayment? Why does this occur? So this slide was put together to answer that question. Okay. And first, processing and other administrative errors. As you can imagine, there are a lot of errors that occur within Medicare as there are different processing systems, edits, audits, and systems that work together that aren't necessarily processing systems. For instance, the common working file is a communication hub between all the processing systems, the eligibility systems, and the primary payer system. All of those can create different issues when things are updated and things happen. We all know how the systems work together, and technology is amazing when it works, but when it doesn't work, we do have some issues. So I wanted to bring that one up first. Incorrect coding can cause an overpayment, insufficient documentation. There are medical necessity errors. There's bundling, and this is when two services are not separately payable, or a type of service is included in the payment for another service. So, for instance, if a person is in a hospital, the labs must bill certain things to the hospital, where the professional service of that lab, the reading of it, would be billed to Medicare directly. The bundling portion would be the lab billing the hospital. There are a lot of automated edits. They look for medical necessity, they look for correct coding, they look to make sure that there isn't something unbundling when it should be bundling. These are all automated edits. In other words, no person has to stop it. We also have what is called the primary payer information. This causes a lot of overpayments. As a matter of fact, it's so frequent that we have questions on our refund forms and on our overpayment request forms that you get to check to tell us whether this is the situation. When you're looking at whether there's a primary payer, Medicare refers to this as Medicare Secondary Payer, or MSP. We'll talk more about that as we get more into it. The last one is eligibility issues. And yes, CMS does have a variety of eligibility issues that can occur. Here's the thing, Medicare itself, CMS, the Center for Medicare and Medicaid Services, does not determine eligibility. So when we look at that, what we look at or what we determine there to be are quite a few other things that go with it, and that is from the Social Security Administration, Railroad Retirement Board, Medicare Advantage plans. These all determine a portion of Medicare eligibility. So as you can imagine, there's a lot of crossover issues. This is not all inclusive. There's a lot more reasons that can. I just wanted to bring up some of the more common ones so that you could look at these. Along with these questions and the reasons for it, they also asked who can identify an overpayment, and this one is interesting to a lot of people, especially the first one, because the patient can identify an overpayment. But I will tell you that if the patient identifies an overpayment, we do a bit of investigation before just assuming the overpayment occurs. So let me give you an example. The patient says, I've never seen that patient, or I've never seen that provider. Well, that may actually be correct, and it may not be billed incorrectly. So that would be the professional components of a diagnostic test. Did they see the doctor that read that test? Not necessarily. What about a radiologist reading the x-ray? They didn't necessarily see that radiologist. They may never even know who that radiologist is. So we do get those types of complaints, and before we issue an overpayment, we do have to investigate them. And that's when some of you will get an additional documentation request. If you don't respond to that request, then we will also issue an overpayment. So this does happen. We also hear they paid the incorrect amount. Okay, well, Medicare didn't pay what the patient thought we should. So they're asking us to review based on information. Again, we'll request documentation because we have no idea what you documented within your service and whether it was coded correctly. They may also say we've never had services. This doesn't exist. A lot of times with this one, there's a billing error from the provider's end where they actually might have selected the wrong patient. An example, you have two patients named Tom Ryan. One of them was born in 1938 and one of them was born in 1948. 38 versus 48. And when you went to bill it, you put the wrong date of birth on there. That will cause an overpayment. We have to take the money back. Well, the provider has to give us the money back and then file a brand new claim, which we then have to process the brand new claim. So that's how a patient can identify it. Also, a patient can appeal anything they want, and sometimes during that appeals process, we identify an overpayment. So the patient says, I don't agree that this should have been denied, or hey, this should be what's happening. We have no idea. So we have a general issued statement by the patient, they don't agree with something, we'll review the entire claim. They don't have to be as specific as a provider in their appeals request, and that's why sometimes they identify it without us really understanding what they're looking for, which then causes us to send you the ADR and to look further into it. The contractor, which is the Medicare administrative contractor, we can identify an overpayment, and we have actual audits and edits built into our system to do this. So this is part of the process. We also can identify an overpayment at an appeals level. So it's incorrectly coded when you get the documentation. You may be asking us to review for additional money, but when we review it, the documentation sent in supports a lower paid code. So that's just one way to do that. Another contractor is the Comprehensive Error Rate Testing Contractor, or CERT contractor. This contractor identifies the national paid claims error rate using a stratified random sample of claims. So what they do is once a claim processes after the fact, they go back for each selective year and they look at a sample of claims. They then identify whether there is an error or not. Well, if there's no error, you're golden. If there does happen to be an error, it can create an overpayment. The next one is the Recovery Audit Contractor, or the RAC. They work with Recovery Audit Program. Their job is to target certain issues they've identified based on data analysis and which CMS has approved. Now, it could be a procedure code, it could be an overall topic category or benefit category, depending on what CMS has approved. Could be a national edit or a regional edit, jurisdictional edit. So the RAC is a little bit different, okay? But they can identify something that is not paid correctly. If you do not send documentation in response to the CERT contractor or the RAC, you will automatically receive an overpayment and we will be instructed to take your money back. The Qualified Independent Contractor is a review contractor that you trigger to start, or the patient triggers to start, because they handle second level. They're quicks, and they handle second level of the Medicare appeals process. So the max, the person that processed your claim, does the level 1, the quick does the level 2. Last, a quality improvement organization, or QIO, can actually handle a complaint coming from a beneficiary, and it's a quality complaint amongst other things. And they also review the discharge of a patient. So they could create an overpayment under the quality complaint area. Not commonly seen, but we thought we'd put them out there just so you're at least aware of who they are. Again, anytime you receive a letter from Medicare, it doesn't matter if it's the MAC, the CERT, the RAC, the quick, any other type of contractor, you want to make sure you respond according to them. Can a provider identify an overpayment? And absolutely. Once you've identified an overpayment, whether it's through an audit or an edit of your own records, you can identify incorrect billing. You can identify incorrect payer information. In other words, this should have been billed to a primary insurance, but somehow Medicare paid it because that primary insurance isn't on file. You can identify Medicare Advantage plans, or MA plans, which is actually Part C Medicare. It is still Medicare, it's just not traditional fee-for-service Medicare. So again, lots of different things can happen with that, and as a provider, yeah, you can identify any of that. Once you've identified it, you can ask us to take the money back, or you can issue us the money back. We'll talk more about those two options when we get into the options for returning. We were asked specifically about some of the federal entities that can identify overpayments. So we put this slide in. So for instance, the Office of Inspector General, they actually are the watchdog for the programs under DHHS, so the Department of Health and Human Services, so it's the OIG. So they're at about the same level as CMS, it's just they do a different function. Their job is to investigate potential liabilities for anything paid under DHHS that does include the Medicare program. They do publish an annual work plan on what they're looking at, and then they will request medical records if needed to support the services. Sometimes part of what they're looking at are automated edits, which may not need a medical record. It may have been an edit that failed and therefore was paid, the claim was paid incorrectly, just depending. An example of that would be like a once in a lifetime benefit that got paid twice in a lifetime. The edit didn't work, so something happened there. So they don't necessarily always request, but normally they will. The Federal Bureau of Investigation, or FBI, has a healthcare fraud and abuse area as well, or unit, depending on how you want to look at it, and they do investigate fraud and abuse. Okay, so I will tell you, when you look at the FBI, if they're contacting you, you want to make sure you respond. They're looking at you from a legal entity or legal matter. Can the Department of Health and Human Services request this? Absolutely. As a matter of fact, the Department of Health and Human Services does one of the Medicare appeal process levels. Just like the Centers for Medicare and Medicaid Services, they'll do a level 3, which is an administrative law judge hearing. The Department of Health and Human Services will do a level 4 appeal process, which is the Medicare Appeals Council. So yes, they can do that. Along with CMS, DHHS can instruct others to look at items. There is a contractor specifically called the Supplemental Medical Review Contractor. Um, One of my favorite terms that I've heard for them is that they're a special projects contractor. The reason I like that term is because that's really what they are. CMS will instruct them what to do, and those instructions can come down from the Department of Health and Human Services as well to the Centers for Medicare and Medicaid Services and be given to this contractor. So a lot going on with that. Hopefully that does make sense a little bit there. And the last one is, can a federal district court provide a medical review? Absolutely, especially if you're using a level 5 appeal. Okay. Level 5 in the appeals process is a federal district court review, and they're going to look at whatever they're going to look at, and that can be medical review, that can be anything like that. So there's a lot of different ways to do that. So hopefully that answers those questions. But again, if I didn't hit whatever contract or entity you were looking for, provide a little bit more with that. Our next slide is actually one that people go over very often and they don't think about this. Our system can actually set up an overpayment without anyone ever looking at it, touching it, or doing anything. How does this happen? The most common occurrence occurs with the communication to the common working file. Now again, the CWF, or common working file, it's kind of a communications hub. It's in the middle of everything that we do. And the reason that we say it's the most common way it occurs, CWF can do an unsolicited response to what is called our high class, or our healthcare integrated accounting system, and I can't remember what the full acronym is for. Maybe Mary will look that up for me. It's high class. But that is our accounting system. It creates our accounts receivable, and it'll tell them, hey, there's an error, set this up. And it does. The system does it. We don't do anything with it. And a letter can actually be mailed to you. So it's very important that you make sure. Well, let me give you an example of this. Okay, an example. The multi-carrier system processes 1,500 claim forms, or 837P electronic biller submissions. These submissions occur very quickly for a diagnostic lab or other services. They can actually occur later the same day, right? Doesn't matter. It's diagnostic or lab or other services. There is no inpatient claim on file at the time, so it goes ahead and pays. 45 days later, the facility completes processing in the Physical Intermediary Standard System, or FIS. The FIS claim posts to the Common Working File. Common Working File checks the feed from the MCS, or the multi-carrier system, where the 1,500 and 837P claim posted, and says, oh, this lab service should have been billed to the facility because that's what the inpatient claim is saying. So therefore, we'll automatically create an overpayment. It doesn't have anything to do with us. Okay? So things like that happen. One of the more common scenarios also is that the Benefit Coordination and Recovery Center, or BCRC, updates the primary payer records in the Coordination of Benefits system. Now, the primary payer records indicate that there is someone who is responsible for making payment before Medicare. It could be an insurance, it could not be. But once that record gets updated, it goes back and looks at the date of service for the effective date, and the Common Working File communicates to again high glass and says, hey, wait, these claims were processed during this time, therefore you need to take all the money back for those claims. So those are just a couple of ways in which the system actually looks at stuff without us like a human intervening. So it is developed in that manner. Okay. So, a little bit about the process, and this is the next question that was asked. Now, I do want to remind everyone Medicare has a great booklet. It's called the Medicare Overpayments Booklet. It looks like this. I gave you a link down here, and this is what I'm going to use to talk about the process because it has a really good chart in it, and I really like that. Okay, so the process first is that an overpayment is identified. We talked about the ways that that happens. Then an accounts receivable is built. Again, this is in high glass. Mary actually did get that acronym for you also. If you look in the chat, it's the Healthcare Integrated General Ledger Accounting System. Again, Healthcare Integrated General Ledger Accounting System, or high glass. You can just write accounting system, right? So it says, hey, we built this in there. Once that's done, what is called a recoupment request or a demand letter goes out. We'll talk more about that. It gives you how much you owe. It gives you, how fast you have to respond. What are your rights? Any of that. If the provider responds with a payment, it will close that high glass, accounts receivable, etc. The response can be an immediate offset, which is a letter requesting us just to take the money back, or you can also appeal, and we'll talk more about those in a little while. But once the offset's once the offset is complete or payment is received, again, there is no money owed. And there are times frames this must occur. You don't get forever to do this, and that's important. Now, we did going to jump back up to this letter for a moment. So, as I said, high glass triggers our system to send you a letter. Okay, triggers a system. What is interesting about that trigger is that it can be a person manually keying it in, saying, I want this or this or this, or it doesn't have to be. The letter will contain the reason for the overpayment, the amount that is due with how we calculated that amount, your right and obligations, any claims that are affected, and any interest rates that will be applicable. So how will they apply and when will they apply? So if you need help understanding the basics of the letter, it is something you have to go to customer service with, okay? Let's go ahead and move on. I'm going to stop here for a second and we're going to walk through the next couple of slides with that booklet. But that means I got to bring the booklet up first. So what we want to do is we want to come, to CMS website, cms.gov. This is the provider website. The other one that I had up is the Medicare.gov website, and this is for the patient, and there is some information out here if you do use this search feature on overpayments that they can say, hey, how much do they owe, and it will explain that for you. When we're on this website, training and education is where the booklet is located, okay? And then it is in the Medicare Learning Network, which is the third item on the left column. You notice the right side of the body changes and you want resources and training right here on the top. It's the first link. Once we open that, we look to the left side, we see resources and training, and underneath that you're provided with 3 links, and we're going to select the top one called Publications and Multimedia. This brings up an entire list. I don't like to look through the list. I just use the filter right here on the top, and then I scroll once I start to filter. And you can see as I start to filter, it will take things out. So the more I filter, the more information goes away. Okay. Here is the overpayments booklet. So for those of you that said, hey, my link's not working, some people have that as a blocked item. That's okay. Go ahead and do exactly what I just did and you'll get there. You can see here's the URL and we'll get that to you. What I like about this is all of the general explanations that I've given you up until now are also available, but I do love to scroll down to page 7. And this is really the part that I like the best because it means I don't have to remember, nor do you. It just gives it to us all in a nice manner. Okay. So the MAC sends the overpayment determination letter within 7 calendar days. Okay. We get this. The last day to send a rebuttal is next, and you will follow through on this slide. We're in the first 30 days, which can take us to here, and then these are the remaining days. So the first 30 days, we send you the letter. Remember, the letter has a date on it, and that is what begins this cycle. Okay. The last day you can submit a rebuttal. A rebuttal is just a written statement saying, I don't agree with this. Okay, so it's not a formal appeal. It's not anything like that. It is literally a written statement. We're going to talk about that a little bit more on slide 18, I believe. Then day 16, the MAC begins the immediate recoupment on day 16 if you request it. We'll talk more about that, but this is something that you have to do. Day 16, standard Part A overpayment recoupment not subject to the recoupment limitations or excluded categories. Okay, then on day 30, this is the big one. The last day to pay it in full before interest occurs. So you can send us an appeal, which is a redetermination. And what we're going to do is look at whether or not we actually owe that. And that's a formal appeals process. It's not the rebuttal, it's a formal appeals process. Here's the thing. While it does stop us from taking money back until the final decision is made, okay, it does not stop interest from applying. And that was one of the questions we had. So day 30. Interest begins on day 31 until it's fully repaid. Day 40, which is going to move, day 31 and 40 move to the next slide. The last day you can repay overpayments before we begin a recoupment. So you can see interest starts applying here, but you actually have 10 more days to repay it. Okay. Once we begin this overpayment process, this recoupment process, that's the offsetting of future claims to fulfill a debt owed to Medicare. That's what we're looking for. Basic things, and you can read through this. Notice on day 90, the MAC attempts to call you if the debt is 60 days delinquent and not in the status excluded from the referral to Treasury. That status can occur for a couple of different reasons, but we will look forward. The reason we don't automatically refer at day 90 is because you do have 120 days to file an appeal. So we do check, oh, did they file an appeal? Okay, that's part of the excluded from referral. The last day you can submit an initial redetermination. Now I want you to notice interest can apply during the time frame between day 31 and day 120. Interest can still apply. You can pay it back to stop that interest and still file the appeal up to 120 days. If we overturn the fact that you owe us that money, we will issue you a check back. And then here it just talks about the remaining days, which is 126 to 150, and the fact that we'll refer it on a little bit. So this chart is just a quick, easy, one-stop shop to look at it and kind of see what happens. Again, if you can't open it for any reason, please feel free to navigate the way that I did there. All right. We went through a lot of information, but as I promised, we're going to go ahead and stop for just a moment and ask Mary, are there any questions? Any questions in the chat? All right, well, I'm not hearing Mary, and so give me 1 second. I just want to look. Doesn't look like there are any questions. There is one comment, so let me get that for you. This is the actual booklet link if you want that. And again, it is on the bottom of that slide, but if you can't open it for whatever reason, there's the link for it. Hopefully that helps you out a little bit. All right. I don't see anything else. So next we're going to talk about some options for returning the money. How do you do that? Well, first, choose one. Here's your two options. One, you can return it in SNAP, which is the electronic way, and that's the Secure Net Access portal on the WPS website. Okay, you can return the money through the refund process or ask for us to take money back under the overpayment claim adjustment screens. So the one that's actually linked here, and I just realized I didn't put the second link, but the one that's actually linked here is the overpayment claim adjustment screen. Paper overpayments are also allowed. There is one form that serves two features, and we'll go ahead and look at SNAP in a moment, but that form serves both of the features that SNAP has separate things for. We'll talk about the issue that comes up when people file the overpayment, but it is listed. Select the correct contract, Medicare type, and state. If you don't do this, we can't apply the overpayment correctly. We can't close the accounts receivable, which means other issues happen. So let's start with SNAP and then move on to paper overpayments. To do that, let's go to the WPS website. So here we go, WPSGHA.com. Right here on the right side, just under the header bars, you have SNAP. Snap. Secure Net Access Portal. I'll just simply call it the portal from this point forward. You can log in. Now, what happens is I can't log in. I don't need the PII stuff. But what I can do is show you the portal user manual to explain what we're going to talk about here related to overpayments. When you ask me what is the best way to return money to WPS or what is the best way to request WPS takes money back from me, the provider, there it is. Snap, the portal, whatever you want to call this online tool, this is the best way. So inside the portal user manual, you can scroll down and you can see, oh, there's a lot of different information. But don't overlook this download button right here. If you just want to be able to download the entire manual in a PDF format, this is where you do that. Now, I'm going to do a fast scroll. So here we go. Ready? Look away. As I do the fast scroll, I want you to look for transactions. And under transactions, which is the header, you're going to look for claims. And under claims, you're going to look for the overpayment claim adjustment. This is how you request we take money back. And this will walk you step by step through this process. However, if you want to give us money back, you're going to continue down from transactions to the next header, which is finance, and you're going to refund money to us. Okay? So depending on the action that you want, you're either going to do the overpayment claim adjustment or you're going to do the refund. And you can do either one. Overpayment claim adjustment, just step by step. This will show you the screens, what you're looking for. So here it is. You want to report an overpayment, and then you can kind of walk through all of the steps, what's needed, what's not needed, all of that type of information. Okay? Now, this is not to send money back. If you want to send money back, you go down below that. Again, look away if you don't like that fast scroll. And what you're looking for is refunds. This is how you can actually start an inquiry on a refund. So you can actually start a refund here. And you go down through all of that. Routing numbers, all that from the bank. And you can see this is how you give us money back. I do want to remind you of this top statement up here. You have to be an electronic funds transfer agreement. You have to have an 588 form, which is the EFT form on file to do this. Okay. So hopefully that all makes sense to everybody. Again, that is the best way. The other way is to go to tools right here. And when you go to tools, I select all tools. When you scroll down, you're looking for the third item in the left column on my screen. It's going to be all forms. Now you say, hey, mine's not located there. That's normal. It means your visibility or your size is different. That means it can adjust from the third item. Once you're inside here, you can do a couple of different things. You can filter for overpayments right here. You can simply scroll down to overpayments or however you want to do it. Okay. We're going to talk about this extended repayment schedule in just a little bit. Here's the CMS form 838, overpayment inquiry form. And if you notice, the last one is the notification and refund form. Okay. So we have two features in Snap, but one form. When you do that, you want to make sure that you have the correct line of business on the top. J5, J8. J5 is Iowa, Kansas, Missouri, Nebraska, or those providers across the nation that report claims through J5. J8 is Indiana and Michigan. Part A is a UB04 biller or an 837I biller. Part B is always going to be a 1500 or 837P. So look at, make sure you're in the right area, and this becomes important when we get down a little bit more. After that, just kind of read through the directions. Again, we really do recommend using Snap, but if you don't want to, there is a form. When we get down in, it's going to talk about a variety of different things, but then you're going to get to the bottom part, and this is the part where the directions are. I'm going to tell you these are our problematic fields: contract, Medicare type, and state. If we download the form, they're actually in one row: contract, Medicare type, and state. During this one, you will select J5 or J8. Where did you submit your claim to? Iowa, Kansas, Missouri, Nebraska, or the national contract, or Indiana and Michigan? Then, how did you submit your claim? A CMS 1500 claim form or 837P electronic transaction or a UB04 837I institutional transaction, and then the state where the service was provided. Make sure you get those filled in correctly or you will have issues. And this is causing a lot of problems for us. A lot of problems for us. Claims just aren't getting offset. Claims aren't getting money taken back immediately. They aren't getting closed. The accounts receivables don't get the match because these fields are not completed correctly. So please take the time to make sure you do that. Okay, so I've gone through those different things. If you would like to use the inquiry section, you can do that. And that's on slide 17. Let me jump back there. So we've done this one. You can also send us an inquiry. Now, what's important about this is that customer service handles general inquiries, but there are inquiries that you can actually have our overpayments department, the people taking the money back, set up, look at, view, do a variety of different things. But please make sure you're using the correct form. So if we look at this inquiry form right here on the web page, see, I'm just going to select it this way. And again, I'm just doing this to show you that the links do work. Overpayment inquiry form. There we go. It'll actually tell you, okay, what are we looking for? Which one are you looking for? Where should we email it? So we do have a variety of different emails. Again, part A and part B are by bill type. What did you bill? Did you bill a 1500? Then you will automatically go to part B. Did you bill a UB04 or an 837I? You automatically go to part A. Unless it's MSP related, then everything goes into one big jumbled mess. Okay. And then it'll tell you, hey, what are you doing down here? What are you looking for? And are you using the right form? So that's what we wanted to make sure everyone is aware of, because we are very limited to what we can use this form for, and that's also defined for you here. That was also under that form section. I just wanted to navigate a different way for you to hopefully help you out understand. All right, back to the slide deck. Again, I've shown you a lot of different things and bounced a little bit, and I apologize for that, but hopefully it does help you out. Actions. Each provider has the right to make a determination as to what their best action is. This can include returning the money. You can reinvestigate and be like, ooh, yep, we owe money. Okay. Now, do you want to return that money, or do you want to file an appeal? Or do you want to do a rebuttal? Now remember, the rebuttal doesn't stop interest from occurring. It doesn't stop, but it will have us look at that information from the overpayment and possibly overturn it, but it's not an appeal. An appeal is very similar to a claims processing appeal, except this is an overpayment appeal, and you must tell us that this is an overpayment appeal. And I'm going to highlight that on the next slide again because it's so important. But there's a couple of dates that are important with appeals. First, the redetermination or level 1 appeal is filed to the Medicare administrative contractor, and the second level of appeal is filed to the qualified independent contractor. If you do not want to start a take back, if you do not want us to start taking that money back, if you file those two levels, first or second, within 30 days of the date on the letter, then we will not start that until after a final decision is made. We being the Medicare administrative contractor doing the level 1, or the qualified independent contractor doing the level 2. However, you do have 120 days to file your level 1 appeal to your MAC, or 180 days to file your level 2 appeal. It's just that 30 days that's important, because that means we won't take it back. You keep your money, but you really do have to wait until that determination is made. Keep in mind, if it takes us additional days to do that, because we do have 30 days after we receive it in office, that interest can be applying too. So you have a balance, and interest can apply, especially if we uphold our original decision on the overpayment. Okay, so it's just up to you. You also have the right to ask for help. Now, asking for help does not mean that you do not agree you owe the money. On the other hand, it does mean that if I pay it back right now, if I pay it all back in one lump sum, I'm going to cause myself an extreme financial burden. Somehow this is going to financially hurt me too much. So then you can ask us to consider an extended repayment schedule. This is just a request for extra time to repay it in full, and we'll talk more about that. Okay. Um, let's move on and talk just a little bit about the appeal because I do think this is just a great opportunity to talk about this. First, when you talk about an appeal, remember we're going to start with the same 5 levels as a claim processing appeal. But you are not reporting a claims processing issue, you are reporting an overpayment disagreement. If I don't get anything else through your heads, please take that back with you. Circle that, highlight that. Because if you say, I don't agree with what happened on the initial claim, which is what a lot of people do, that's not what we're talking about here, right? The claim processed in a certain manner, it has nothing to do with that. It's us taking money back. So you want to make sure it's very clear. However, CMS does use the same 5 levels of the appeals process as the claims process. So the overpayment and claims process, same 5 levels, exactly the same steps. Nothing changes from within that. Okay. So the MAC does your redetermination, the QUIC does your reconsideration, the Office of Medicare Hearing and Appeals does your next decision, and this is a CMS office. The Medicare Appeals Council Review, which is a DHHS or Department of Health and Human Services, does your next level, and finally a Federal District Court or U.S. District Court review. Now, I want to remind everyone there's a link down here to the appeals process. We're not going to go through the full appeals process, but you do want to make sure that you are following all of the time frames. That's what this chart was just put on here for, because if you miss any of these time frames, we will not consider your appeal, whether it's a level 1, 2, 3, 4, or 5. The appropriate entity cannot consider it. Okay. But what happens if you want to do a rebuttal? Now, again, as I stated, this is optional. Why? Because this does not affect your appeal rights. You can do a rebuttal and still do an appeal. That's fine. We do have very specific steps that need to be done with the rebuttal, and you can do an overpayment rebuttal statement down here on the bottom. If you're looking for information on the rebuttal, you can simply search rebuttal, overpayment rebuttal statements, okay, provider enrollment rebuttal. This isn't what we're talking about. It's an overpayment rebuttal, right? So let's just go ahead and select that. It will walk you through all of the information you need about the rebuttal. So I wanted to give you a variety of different mechanisms and ways to kind of move through that, and so you can kind of see your different areas. Now, again, a rebuttal is not mandatory, so please don't feel like you have to do a rebuttal. Okay? And as a reminder, you will see right here, it's not an appeal. Let's jump back to the slides. The next one is the extended repayment schedule, and I had a few people mention this and say they've never heard of it. So the ERS, or the extended repayment schedule, is when you, again, agree you owe money, but if I gave you the full amount back, I would wind up putting myself into jeopardy. And that's a financial jeopardy or a financial burden. So we want to look at this. Let's jump back to the website for just a second. You can do a search up here. Extended repayment schedule, great. This is about overpayments. There's the checklist for part B. If you want to switch that, we also have one for checklist for part A. It just depends on where you're at. If you don't want to do this, come back to this tools section, go to all tools, scroll down and look for forms again. Where would I find this? Here's where I like to do the filter. There we go. Extended repayment schedule, and I can look at the Part A checklist. If I'm in one of the Part B sections, it'll bring that up. And then it'll just talk a little bit about it. So hopefully that helps you. I do recommend that if you take a look at the checklist for Part A, it gives you a lot of information. You can see it's going to give you all the information you need. You have to read through it. And then you'll finally get to the bottom part where you actually begin to do some of the information in the checklist to make sure you have a valid one sent to us. Because you must also include your first payment with this, and then an explanation of why, when, and how you will be repaying it. Okay. Again, that's the Part A checklist. If we flip to Part B, we can do the same thing. Go Tools, and All Forms. Again, I'm not gonna scroll down. I'm just gonna start filtering. That's what I want. Here's the information again. Again, it looks very simple, but you want to make sure that you're opening it up, because here we have the explanation. And then the checklist is right here. So hopefully all of that kind of helps you through the processes of understanding a repayment schedule or extended repayment schedule. Now, I know I didn't get a lot into it, and that's because there's a variety of other factors that go into it, but it's just how to get us money back when you financially could be hurt by it. All right, that's an extended repayment schedule or an ERS. All right, so what's next? Well, next are the remaining unanswered registration questions. Now, as I said, I've tried to answer most of them as we went through. So now is a great opportunity to put your questions in chat because the final section will be the chat questions, and that's coming up in just a few minutes. But let me take a little bit of time to go over these remaining registration questions. One, the question is a question but a statement. You need time to investigate needed time to investigate needed prior to knowing how much needs to be repaid. So you need to do the investigation. And remember, this is 120 days, right? Why is that so important? Because you have 120 days to file the appeal. Now, that is the first level of the appeals process, which is the redetermination to the Medicare Administrative Contractor. However, you can use the 30-day if you want to stop a repayment from occurring. So we can fully repay the claim through an overpayment, a take back, or you can send us a check and still file 120 days. That doesn't happen. So you still have that. Remember, we cannot refer until 125th day to the Treasury should something be outstanding to us. Okay, so a lot going on with that. Many different things going on there. Okay. Um, I just registered for the portal after coming across an overpayment request. Am I currently reviewing options and would like to attend a live webinar regarding this? That's awesome, but I want to remind you that thanks for attending our live webinar. Don't forget we're going to record this and put this onto our YouTube channel as well. So I really would encourage you to take a look at that YouTube channel if you can. Now the YouTube channel has a playlist specifically for the SecureNet Access portal or the portal, and that will contain a lot of different areas. When you're looking at this, look at claims and financial, and those are the two areas you want to make sure you're looking at. This one, I'm not really sure exactly what you were looking for, but the statement was you want to resolve old overpayments. Again, if you've discovered an overpayment and you need to give us the money back, you can do a voluntary refund. And which one is the best way to do that? Well, if you know about it, go ahead and give us the money back voluntarily. Now, that could also be done through an overpayment claim adjustment, OCA. We looked at that, and that's where you're asking us to take the money back. So refunds, give us the money back, or is it a voluntary refund where you're going to give us the money back but also tell us about it? We'll talk more about that. So let me show you what I mean by voluntary refund. Get back, here we go. So we're back on the WPS website and we look at this particular piece of information. If I go back to tools and I go all tools, you can scroll down, and again, we're going to go to all forms. And if I want to know more about refund, I can do that. Overpayment notification refund form. This is where you can tell us that you're giving us money back. It's a voluntary refund. You must then complete all of the instructions. Okay, so this didn't change. It's nothing different. Is there anything wrong with just simply doing the refund and explaining the e-refund? Nope, there's nothing wrong with doing that. But if you're using this form, this is what you're going to want to do. Again, here's a couple of specific reasons, but you're going to go down and you're going to explain, I discovered an overpayment for whatever reason. So that's how we do it. Now, there is an immediate offset form, so you've got the overpayment letter, but what do you do now that you want us to take the money back? Let's go back to all forms for a second. So you want us to start offsetting that. Oh, nope, that wasn't where I want it to be. I want to be in the filter. Okay, so here's our immediate recoupment, our immediate offset. If we open that up, what this form will do is if we read through it, it just tells us, hey, you've got a specific demand letter. We want to offset all future payments, or do you want to offset just that specific demand letter? You will again use this form should you want to cancel if you choose all future. Okay, so it's right here. It's under forms. You just need to look for the immediate recoupment request form and fill this out. Again, make sure you have these top three areas correct. You can download the form and you're just going to fill it out. Here's those top three areas that are causing us the issues. I would like all, I would like to discontinue. So there you go. So this would be a one time. If not, I would like all checked, it would be one time. If you would like all checked, you got to pick the option for that. If you don't want either one and you want to stop all of that from happening, pick the option to discontinue. Okay. So hopefully that gets through all of that and how to resolve that and depending on what you want to do with it. Okay. I was asked a very interesting question, which really didn't have anything to do with it, but I want to remind everyone that an overpayment can occur to eligibility. So what age can you apply for Medicare? First, Medicare is offered at 65 to those who have worked enough quarters in their lifetime or who have a spouse that have worked enough quarters. This is done through the Railroad Retirement Board of the Social Security Administration, and this is automatically done at age 65. However, if you are disabled, then you can apply for SSDI, and it typically takes 24 months after receiving SSDI, which is Social Security Disability Income, to receive Medicare. So there isn't a set age. On the other hand, there is some working criteria that go with it. So hopefully that answers that question. If not, throw it back into the chat. All right. That's all I have for registration questions. So let's go ahead and move on to those chat questions. Barry, anything?
Great job, Tom. A lot of great information there. We do have one unanswered question that is currently in the chat. It says, does the 120-day time frame for the appeals process start from the original claim processing date or from the overpayment date?
Ooh, that's such an amazing question. And I'm going to give you a long answer, a bit of a longer answer on this one. It depends on what you write on the on the appeals request. If you write, I don't agree with the decision or the claims decision made, it will start from the claims processing date. If you write, I don't agree with the overpayment, we will start from the overpayment letter date. So it's very, very important that you put overpayment. Let me give you an example. Medicare's been paying primary for 4 years. All of this sudden, something comes back and backdates that to say, ooh, they should have had this other insurance paying primary for those 4 years. If you say claim on there, guess what? We will dismiss it because it wasn't filed within 120 days from that claim decision. But if you say overpayment on there, then we look at the overpayment letter. So that's why it's such a good question. I just want to reiterate that. Always state overpayment if you want it to start from the overpayment letter, or state claim if you want the appeal process timeframes to start from the claim letter. Um, Mary, anything you'd like to add?
I don't have anything to add, Tom.
Perfect. Okay, then any other questions?
There are no other questions in the chat.
All right, we might as well keep moving right along then. We'll end up on time here. So just as a reminder, we are going to ask you to take a survey. A couple of ways to do that. There's a link in the chat. We're going to go ahead and close this event. When we do, a pop-up box will occur. It's going to look like the one on the upper right side. You could also take that link in a follow-up email we're going to send you in just a few minutes. Or last but not least, if you're watching this as an encore presentation, you will see a little picture appear. That's the lower right side, and it says online survey. Now, why do we ask for that? Well, it's 5 questions. What we're looking for is how we did with this event. Did we answer your questions? Did we give you the information? That type of thing. And again, it's 5 questions. You can elect to take more questions. That's great, but you don't have to. Okay, we really would like it if you would take the time. We want to remind everyone that the redetermination decisions letters are going to stop for paper delivery when the request was received in SNAP. So again, this is for Part A, which is the UB04 or the 837I billers. If you sent a letter in, or if you sent a request for a redetermination, which again we've talked quite a bit about, our letters will be posted into SNAP if the request came in SNAP. So hopefully that makes sense to everybody. This slide is not in your slide deck. It's just a reference or an extra material slide, an update slide. All right. That brings us to the end. So we'd like to thank everybody for your time. We would really like it if you would send us any questions you have on the overpayments or the process for the next 7 days to wps.gha.education@WPSIC. Include the subject line overpayments. Please make sure that you do take the survey. That would be great. At this point, I'd like to thank you for attending. Wish you a good day and let you know that you can disconnect. Thanks, everybody.